steps to facilitate access to sexual health services. We're really pleased to have so many of you on from many of our SHIFT districts, and we wanted to quickly go through the disclaimer here, which is, let's see, great, that this resource is supported by a cooperative agreement from the Centers for Disease Control and Prevention, and its contents are solely the responsibility of the authors and do not necessarily represent the views of the CDC, as well as the Department of Health and Human Services. So moving on, in terms of logistics, we're using some different software than I'm familiar with, but we're using ReadyChat, and so there is a chat function in this, and we want to encourage you to use the chat function to be able to talk. And we also are going to be muting folks proactively so that we don't have extra sound coming in, but we'll unmute people as they're speaking or as they want to speak throughout the webinar. So we want to make this as interactive as possible. Thank you all for participating.
The conference has been muted.
Go ahead, Lori. All right, so next slide, logistics. We've done that. Now we're going to meet the presenters. So there are 3 of us presenting here today. Myself from the Michigan Department of Education, and we have Amy Peterson, who is an STD program specialist with the Michigan Department of Health and Human Services, and Sarah Stahlberg, who's with the National Coalition of STD Directors, and really pleased to have all of you on as well. So for the agenda, we're going to be talking about SHIFT a little bit and sexual health services. And then we're going to be talking about different pieces of facilitating access to sexual health services. So identifying champions, identifying and assessing policies, looking at some of the providers in your community and resources, breaking down some of the barriers that exist, raising awareness, establishing some procedures and next steps. And as part of it, we're going to share with you a new framework that I think will be helpful in terms of moving facilitating access to sexual health services forward in your districts and communities. So here are the objectives. I won't read them to you, but we have some objectives. Wanted to share this new framework, talk about some strategies to advance your work around facilitating access, and then think about one person or resource that you can follow up with to continue this effort. So next slide. So for those of you who have been coming to our SHIFT meetings, this map is very familiar to you, but for those of you who haven't, the CDC funds work from the Michigan Department of Education to look at multiple areas, and we are working closely with 14 school districts throughout Michigan, and here's a map of those school districts. We're really pleased to have school districts from West Side, Central Michigan, Southeast Michigan. We wish there was more involvement, that we'd had school districts from Northern Michigan, but the one district that we did have, unfortunately, wasn't able to continue. But we have a wonderful group of districts who are involved in this, and there's a lot of cross-sharing of successes and challenges between districts that helps to move this work forward. Next slide. So we have a number of major components of SHIFT, and SHIFT is Michigan's acronym. It stands for Sexual Health Initiative for Transformation. The first is ESHE, or Exemplary Sexual Health Education, and again, those who've been on the district side are very familiar with these, but just so you can understand the big picture, as part of this grant effort, we're encouraging districts to look at their sexual health education or their sex education to see that it's quality. And but we know that when students learn in the classroom that's really important, but if we really want to help keep young people safe and healthy, that's not enough. We need to be able to help them to be able to access needed health services as well, and hence the second logo there, SHS, and that's going to be the focus of this call today. We also, as part of this initiative, are looking at how we can create safer and more supportive environments in our schools, and that's the SSE green logo on the right. And then we ask districts to have kind of a multifaceted district-level leadership team, hence the blue acronym in the lower left-hand corner. And so, many of you or all of you are part of that district-level leadership team with the districts, and that's so important to put all these different heads together to think about how we can move forward on these components. There's a policy piece that with any of these pieces that threads through it, and we'll be talking some about policy today. And we also look at populations who are at greatest risk. And so in Michigan, we've identified lesbian, gay, bisexual, transgender, and questioning youth as a population that is at greater risk on multiple levels. And so we try to make sure that our efforts, whether it be sex ed or access to sexual health services or safe and supportive school environments, address this population as well. So moving on. So if you think about facilitating access to health services, what are we really talking about here? And again, those who have been in the districts have seen this many times, but we're talking about increasing utilization of existing school-based services and also identifying youth-friendly providers that are in the community and trying to strengthen those organizational linkages so that students know where they can turn to and where they can go, and there's just a cross-connection between schools and community agencies. And to have a clear referral system so that students know about where to go and school staff can direct them to where they need to go. So next slide. So in terms of what are we talking about when we say sexual health services, so the CDC has defined these as HIV testing, STD screening, pregnancy testing, provision of contraception, provision of condoms, provision of condom-compatible lubricant, and also vaccinations. So these are all the different kinds of services, and most of these services, particularly the provision of contraception and condoms, those ones can't happen on school property, not most of them, but those two can't because of our laws in Michigan. So when we think about the different school districts in Michigan, there's I think about 3 different types of districts. We have districts that are fortunate to have school-based health centers in them. They wouldn't necessarily be in every building, but they have those kind of mini doctor's offices in their schools and that offer many of the services other than, they can't provide contraception, but other services, not just the sexual health services, but many other critical health-related services on site. Then we also have school districts that don't have a school-based health center, but they have nurses, and the nurses can be important resources in terms of accessing health care, both within the school setting as well as in the community. And then we have school districts that have no school-based health center and no nurse. And so for them, there's some greater challenges because it's not even necessarily clear who the person is that's going to refer people to services, et cetera. So they lean more heavily on other school health staff. So community providers are essential. And so as we move into this next piece of the webinar, I'm going to introduce Sarah at National Coalition of STD Directors. And they have done a lot of work on this whole component of facilitating access to sexual health services and have, in fact, developed this huge manual that's about developing a referral system. And she can tell you more about that and a kind of pared down framework that we developed from that.
Hi, everyone. Thank you for having me. So for those of you that aren't familiar, I wanted to introduce this toolkit that Lori was talking about, pictured here on the screen. You may have seen it before, but this was developed by NCSD, the National Coalition of STD Directors, which is my organization, along with another national organization, CAI. They're based in New York City, and they work with local school districts on sexual health services. So the toolkit provides resources, guidance, and tools that are really designed to help school districts better facilitate access to services for young people. There's also a companion guide that goes with this, all about creating and maintaining strategic partnerships in order to effectively support our young people in schools. So the framework that was shared with you just before the webinar and that we are discussing today was built as a more digestible version of this toolkit. But if you're interested in exploring all of the tools and resources, you can visit the URL that's on your screen or the Michigan Shift Dropbox folder, which is a link on the actual framework. And we'll also share all of these again after the webinar so that you have access to them. So this framework that we're talking about today, so the toolkit is an evidence-informed, comprehensive approach to increasing access to services by making referrals or facilitating other linkages to care. But in recognition that it is a massive toolkit, it's a lot to digest for school districts where I know that you all have many, many hats. So we broke it down a little bit and created a new framework just for Michigan based on the toolkit. And this provides easier steps and some resources for you all to break it down. It's based on the broader toolkit, but it is intended to be nonlinear in nature. As Lori mentioned, we know there's a strong connection between educational attainment and student health, and that really creates the basis for this work. I should also note that this framework that we're talking about today is in draft form. You should see a very bold watermark on it. But we wanted to make sure that we introduce it to you and kind of talk through some of the components. So you should let us know if you have any questions about that. And with that, Amy Peterson is going to talk about identifying champions.
Excellent. Thanks, Sarah, and thanks, Lori. So this is Amy Peterson. I am with the Michigan Department of Health and Human Services in the STD program. I've met many of you, and there's a few folks on the line who I don't know, but I just want to thank you for participating today. So we're going to be kind of stepping through the framework that Sarah was just talking about, starting with the first step, or the first component, which is identifying champions for your district-level leadership team. And while some of you might look at this and say, you know, I've already done this. I have my committee. I have my group together. We want you to just take a second and to reflect on that a little bit and to think about kind of where are the strengths and what are the areas maybe of opportunity for you to strengthen your leadership team when it comes particularly to the area of accessing sexual health services. Some districts that we've heard from actually have subcommittees of their leadership team that are working on particular components of their SHIFT initiative. And so if you would think for yourselves, if I had, and this isn't the case if you don't already, if I had a subcommittee that was only committed to or only focusing on sexual health services, would it be a strong group? Do I have enough people, enough breadth of experience, and enough commitment to sexual health services to have that be a strong component? So those are some things that we want you to be thinking about. Also, we want to acknowledge that this is not a one-size-fits-all. Like it doesn't say that you have to have, you know, A person, B person, C person. It really does, it's intended to be a mix from your community and to be individuals, simply individuals who are committed to this and wanting to see it go forward and do well. So if you'll go to the next slide for me, Sarah. Sorry, I can advance my own, I apologize. Those of you who are on the line, you do have, if you are on the webinar through the Ready Talk, you have access to a survey. And this survey says, which of the following do you have represented on your SHIFT leadership team? And if you would take a second with your cursor and just mark all that apply. Go ahead and tell us who you have on your SHIFT leadership team. Which of these types of individuals are already on there? So I'm going to wait a second and let you guys respond to that. And again, this is for those of you who are from a SHIFT district. Excellent. Looks like we've got responses coming in. We'll leave it open for just another minute. Going once, twice. Last chance if you haven't already responded. Okay. So this shows us what your responses were, and it's great to see that we have so much diversity in the individuals who are represented and the types of individuals. The strongest, the majority of you state that you have parents and families represented on your committee, which is fantastic. Other school staff, so folks who you've identified in your schools. Community partners, and we have those defined as health department, community health providers, youth serving organizations. So there's a few different ones I'm sure that are represented in that category. Some of the ones where we have a little bit smaller numbers are school counselor, school social worker, and then students. And about half of you have students on your SHIFT committee, and we definitely want to encourage that. And if you think about what are the various ways, and we'll talk more about that in a little while, how you can get input from your youth. So it's great to see the diversity and that the majority of you do have parents and other community partners, which are particularly important when we're talking about access to sexual health services, to make sure that we're kind of all on the same page with that. Thanks, guys. All right, so in thinking about maybe rounding out your team and who else you might want to bring on board, if maybe during that little checkbox exercise you said, you know what, I didn't realize that we don't have this person on. These are just some things to consider in identifying other individuals to pull in. Always asking for volunteers, looking at that category that maybe you were missing and starting a conversation with other people on your shift leadership team. You know, who in this category or this type of person might be available. So looking for volunteers, having those conversations individually, talking to your administrators, and you know, while we like to have this be a voluntary activity, sometimes that right person with the knowledge might be an appointee and not just a person who says, yeah, I want to do this. And then also think about the other community partners that you already have on there, and they may know of other people in the community who would be good as well. Thanks for that. We're going to move on to number 2 now on the framework, and that is to assess relevant policies and procedures. And Sarah's going to start us off.
Thanks, Amy. So I wanted to start us at kind of a basic level with policy because I recognize that it can be the most intimidating part about this process, but it is very important. So sexual health service policies set forth the expectations that support the establishment and implementation of health services in the school and in the broader school community. So they determine when and under what circumstances students can receive information from school staff related to SHS, access school-based health services, and or access services in the community. So having worked in a school district myself, I know that it sometimes feels easier to just move forward doing these things or fly under the radar without going through the possible drama of developing policy. But for program sustainability, transparency purposes, and to ensure that your students continue to receive services that they may need, it's really helpful to go through a formal process and to have a policy on record. And I wanted to share an example of that. So this is a quote from the Project Connect program. Project Connect is an evidence-based, scalable intervention that was designed to link young people with high-quality healthcare services in high-need areas. So the program has been very well evaluated. This is some feedback that they received from a project staff member about policy development. So I'll just leave that on this. I don't need to read it to you all, but I'll leave it up on the screen for a moment so you can read that. The idea is that school staff actually feels empowered to better serve their students by having policy in place. So some federal policy. So there's 2 prevailing federal level policies that kind of govern this work. Many of you are probably familiar with FERPA, the Family Educational Rights and Privacy Act, which protects student and family privacy and also allows access to educational records. So we mention that in context because FERPA has implications for the confidentiality of private information. So for example, if a school nurse makes a referral to a confidential service, such as, let's say, STD testing, this becomes a part of the student's school health and education record, and parents have access to that information. HIPAA applies in healthcare settings, so the school-based or school-linked health clinic, a private provider, or some community health settings. And HIPAA really protects the privacy and security of individually identifiable health information, including who can access that and when. So to talk a little bit more about what we mean by confidentiality, the American School Health Association really recommends that confidentiality policies include the information covered, so what information is protected under confidentiality, how that information is kept confidential, so where are those records actually physically located, and how do you ensure that it is confidential? Who can the information be shared with? So like parents, other school staff, outside agencies, how does that all work? And what are the instances that maintaining confidentiality is not possible? So if the student represents a harm to themselves or others, or is experiencing some type of reportable abuse, it's always important to explore what this process looks like for your individual district and school community. So this is back to Amy, who's going to talk more about what the policies look like in Michigan.
Thank you. So Sarah shared with some of those national policies and things that cross-cut, but I just wanted to clarify a few things about Michigan law and what our opportunities and restrictions are here in Michigan. So one of the things that we commonly hear about is in terms of minors and access to sexual health services and their opportunity to consent to their own services. And what's listed here on the screen, contraceptive services, STI testing and treatment, prenatal care if an individual is pregnant, mental health and substance abuse services, medical care if they do have a child, so medical care for that child is also covered, and HIV testing and treatment. All of those services in Michigan, the law does allow for individuals or adolescents to consent to their own care in those areas. In terms of the law, one of the areas that's a challenge often is that it does not say what is the bottom number, like how young. And so what I will let you know is that oftentimes it's commonly interpreted as 13 and over, since if an individual is under 13 and there's anything associated with their sexual activity, it does kick in questions around and requirements around mandatory reporting in terms of suspected sexual assault. So for that reason, it often is interpreted as 13 and above, but the law is silent on the actual age, so that may be something, again, to address in your own policies about do you work with youth if they're 14 and over or 15, 16, kind of where is your line, because that may be different in your policies than what the law is. But I just wanted to clarify that this is the law, that in Michigan, again, adolescents and young adults can consent to their own access to these sexual health services. All right, so something that I wanted to clarify, what we have here on the screen is actually a sample. It's a picture of an explanation of benefits. This is not even a Michigan one. We just wanted to have you have this in your mind and understand that while minors in Michigan can consent to their own care, meaning they can go in and say, I want to get an STD test, and the provider has to allow them to have that STD test with just their own signature. They do not have to have their parents' consent for them to access that service. That minor consent is not the same as guaranteed confidentiality. So that's why we have that big no zone here. And the reason for that, and one of the major challenges, is with the explanation of benefits, particularly if that service is covered by insurance. So what we want you to be aware of is that there is a disconnect. Yes, adolescents can consent to their own care and treatment. However, that does not guarantee that that service will be confidential because of concerns around explanation of benefits. So it is important for us to be aware and to know what types of providers actually do put in place policies to protect the adolescent's confidentiality, which is a step above allowing the adolescent to be able to consent to their own care and treatment. So some of those facilities and some of the sites where an adolescent could access services and have it be truly confidential, it is Title 10 or family planning sites. They are required by federal laws and by their funding to make sure that services are available for adolescents that are confidential. And in Michigan, Planned Parenthood and some local health departments receive that funding and are governed by that. And what that usually means is you'll hear the language of our services are available to all individuals regardless of their ability to pay, and that they are either at free or at low cost. And the sliding fee scales at these sites do slide all the way to zero. So for instance, an adolescent presenting for services could receive services at no cost with the understanding that their parents may have insurance, but the site is not able to bill that insurance and maintain that patient's confidentiality. So they charge those services to their grants instead. So again, Title 10 is one example. Local health department STD and HIV clinics also follow similar guidelines and provide those services even to minors at free or low cost, regardless of their ability to pay. And then school-based health centers. School-based health centers have been managing this process for many, many years and decades now. And so school-based health centers also have in place policies and procedures so that if they're providing one of these sensitive services, they do not bill those services to private insurance so that any explanation of benefits that goes home to the parent does not breach the confidentiality of the adolescent who's requesting those services. I hope that's helpful, and we're going to move on now to just an example. So far, we've been talking about specific policies and procedures and also laws at the national and at the state level. In the framework, though, we use this language of assessing relevant policies and procedures. So we've gone from federal to state, and now we're going to talk a little bit about your district level policies and procedures. And to start off, I wanted to focus on that language of assessing, because that may be one of the first things that you need to do in your districts as you're thinking about what are our policies and procedures that may help our adolescents to access sexual health services. In this case, I wanted to, and I have the permission from our Ann Arbor partners to talk a little bit about, because they have already stepped forward and drafted some policies about increasing access to sexual health services. But I love their example because it talks, beginning steps for them were actually, again, to assess what are their current policies that may be relevant to this. And so I'm just going to read a bit from their draft policy, which because it is in draft, we're not sharing it explicitly, but I, again, want to thank them for giving their permission to speak about it a little bit. So as they were putting together their policy, the observations that they made were that their school district does not currently have a policy to address referrals to sexual health services. And at the same time, they acknowledge that there are several existing policies that do have an impact on this, this direction that they're taking. And so some of those include their attendance policy, because will they allow, is this an excused absence if a student steps out of school to access confidential services? Also, they need to consider their definition of local wellness, their relationship with community groups and agencies. That's another policy that they have. So what is that interaction like? What are the agreements that they have with community groups and agencies? They currently have a policy on controversial issues, including sex education, and there may be pieces of that policy that are relevant to this or that need to be adjusted depending on what their future policy is. They also have in place a policy around the content of their parent and student handbook, including the rights and responsibilities of parents and of the adolescents or the students in their school, which of course becomes really relevant to this information when we're talking about confidential services. So these were some examples of the policies that they have already on the books that they understood were going to be connected to or related to a new policy on how to make referrals to sexual health services in the community.
This is Lori. I'm going to chime in for a second and say I'm going to touch, I don't know if Kristen is on the phone right now, but I do think because the SHIFT districts are sharing things even when they're not done just to help each other out, my guess is that Kristen would be willing to share with the SHIFT districts their document in draft form, knowing that it's draft. But I can check.
Great. Is there anybody from Ann Arbor on the phone? Oh, we may have someone. Oh, they're muted. I'm sorry.
Chris, can we unmute Kristen Mahler? It's 734-216.
Sarah, are you able to do that?
Yeah, I'm looking for her number.
Gotcha. It's 734-973-971. Yeah.
Kristen, are you there?
I am. I am there, and I'll be happy to share. I'd just like to clarify that it's not Ann Arbor Pioneer, but it's all of Ann Arbor Public Schools, because Pioneer is just one of the high schools.
Apologize. Thank you for that.
But, yeah.
Great. And I also wanted to give a plug for Ann Arbor in the sense that in talking with Sarah, she was going to speak with all the districts in Connecticut, and she said, can I just share this is, you had done such good work in terms of really reviewing different policies. So sometimes you feel like you're never a prophet in your own backyard, but you're really doing great work.
Thank you. I've got Beth helping me, too.
Thanks, Beth.
So, Kristen, is there anything else that you would like to tell us about your process or kind of other things that came up for you as you were preparing this policy?
I did have a real struggle finding actual policies to follow. I went onto websites from the different districts mentioned in the handbook, and I had sort of wanted a real policy, not just the key components of the policy.
Mm-hmm.
And since I wasn't able to find that, I just sort of took our board policies and plugged in the information that I wanted to with the numbers and the format. But, for instance, I went on to, I think it was Boston's school district. I wasn't able to find the actual policy. The one in California, I wasn't able to find the actual policy. So maybe if we can get some examples of actual policies, that might help some of the other districts.
Thank you. Maybe that's a note, Sarah, if you can document that, and we can see if there's some other national partners who would be willing to share.
But I'm more than happy to share ours, even though it's in draft form.
Great, thank you. And we just weren't sure, so we didn't want to put you on that spot. So thank you for that.
Thank you.
Excellent. All right, with that then, I'm going to go ahead and move forward, and thank you again. We appreciate your time, Kristen. And we're going to talk now a little bit about Lakeview. Lakeview is also a school district that has kind of taken up the mantle on this, and they have developed a policy, and they've actually moved it through and gained approval of their referral protocol. And Lori, I know that you spoke with Jim, so do you want to take it from here?
Sure. Yeah. So Jim Owen, if you happen to be here, if you could just text in and say you're here, but I'm guessing you're not. They had an emergency with social media and actually had to cancel school today, unfortunately. So anyway, he was kind enough to talk to me today on his cell phone and kind of fill me in on what they did. But they have a document that's a number of pages long, and I'm sure that he would be happy to share. I know that he's already shared with Dee Dee at in Northwest, but they have a situation where they have a relatively new school-based health center, and it's located physically in the middle school. And while the high school is closed, it's not the same building, so it is a separate building. And so one of the issues that they needed to think about was how do you get students to be able to access the clinic even if they're not in the same building. And so they worked through with their stakeholders, and they figured out a process that could work that would maintain student privacy and make sure their visit was confidential. One of their first pieces that they have either the counselor or the nurse do some triage with the students. So if the student wants to go over to the clinic, they can certainly do that, but they just to find out what it is that they want to be seen for, that type of thing. And then the counselor or nurse is involved in contacting the clinic to let them know that they're coming. So they wanted to streamline that process. They've laid out that procedure, and they've really done a good job of advertising it. They have a Channel 1 News and let people know through that vehicle about this, and they also have flyers in the office, because you might have a procedure, but if people don't know about it, then it's not very useful. Same with a policy. And so they're going to be doing a video, and they're having a teacher work together with students to put it together. That's and this is, I think, in the works and almost done now, to show what it's like to go through the process of going to the school-based health center, so that it's more personalized, and they don't just have an image of what it might be like, but they can see literally the step-by-step process of what it's like, what the school-based health center looks like, what they're going to be asked, et cetera. A second piece was that they realized that there is an issue with kind of a tension that exists between trying to make sure that students have access to services like pregnancy and STI testing, but at the same time making sure that those are confidential services, and trying to make sure that there was a way to account for their not having left the school grounds entirely, but they are at the school-based health center and seeking services there. And so what they do is they mark it as a school-related absence, so that if the parent or someone were to call in and ask about where the student is, they can say that it's school-related, it's not, but they're absent at the moment, and they worked through their pupil accounting people and others to get that procedure in place. So I know I didn't do as much justice to it as if Jim were speaking, but it kind of gives you an idea of some of the issues that they were wrestling with, and they worked through, and they have in a school-adopted procedure. They're really looking at kind of juggling confidentiality, but also transparency and making sure that they were up and up and that everybody knew what the situation was, and that you could also account for the students and make sure that they weren't kind of lost between the cracks.
Great stuff. Thank you so much, Lori.
Yeah.
We're going to go ahead then, and we're going to move to step number 3 in the framework, and Sarah's going to talk to us about identifying providers and resources.
Yep. So a lot of you, because you're in school districts, have probably already done some sort of community mapping of sorts to see, what the available resources are in your area. So we're going to talk about identifying and finding providers and other resources for the purposes of connecting students to services. So there are several ways that I've mapped out here to identify providers and resources in your community. I would start by working with your state and local health department. So Amy is here on the phone as a state health department person, but also connect with your local health department and some community-based organizations to identify they might already have a current directory of available sexual health services and folks that provide them in your community, in your area. You can also look within your own school community. So ask the school nurse if you have one, school staff, school-based health center staff if you have one of those, and also students for recommendations. Where would they go? And I know that you have a wonderful interview tool that Lori and team have shared with you that I think we're going to talk about in a little bit. And that's a great way to collect that type of information. There are also some web-based service locators, such as those that are listed here, and those are hyperlinked, so when you get the slides, you can click on them. So for HIV testing sites, family planning clinics, providers that have contraceptive access. We also compiled a full list of online service locators where you can just plug in your zip code, and that is on the Dropbox page, which is linked at the bottom of the framework, and we'll share that again after the webinar. And finally, I wanted to talk about when you're identifying providers, we want to think about assessing them for adolescent friendliness. So I'll break that down again in a minute, and I wanted to also talk briefly about this list of providers that you're cultivating. So are you just gathering them all and throwing them in one place? Ideally, we want to use some sort of process and input from key stakeholders. So that team that you were building in step 1, think about how you can use them to really go through this list of providers that you're pulling together and fully vet them to make sure that students are receiving quality services and there's transparency for the broader school community to know and understand the options that are available to the student. So for adolescent friendliness, what does that mean? So we want to think about these 5 things here. So when you're determining if they're adolescent friendly, you want to consider the types of services that are available. So do they offer STD testing and treatment, just testing? Do they prescribe birth control pills? Do they do IUD insertion on site? Do they have treatment options? Do they have, X, Y, and Z? And then you want to think about confidentiality and cost. So do they require parental consent at this particular clinic? Are the services provided without regard of ability to pay? Amy mentioned having a sliding scale. A lot of places will even have that sliding scale go down to 0. That is very adolescent friendly because then they don't have to worry about payment or insurance. Appointment options and location. So are walk-in services available? Are appointments available the same or next day? Is the location accessible to public transportation, or is it near the school? Do they have a bike rack so that students could ride their bike there? Things like that. And then the physical space. So does the waiting room have posters or magazines targeted towards teens? Are the staff welcoming and friendly? Is the space clean and well taken care of? I know that I would like to go somewhere that's clean. And are staff friendly to all young people, including varied race, ethnicity, sexual orientation, gender identity? And then finally, what other services do they have available on site? Do they have on-site or linkages to mental health, education, housing support, mentoring programs, or a whole range of other social support services that our young people might need in addition to sexual health care? So we have a really great, more comprehensive list of what adolescent friendliness means, and you can find that in the toolkit that we mentioned at the beginning of this webinar. So there are a few ways that we can measure for adolescent friendliness in varying levels of intensity. And this can play out in different ways. So you might also consider a combination of these three methods. You can ask the providers to self-report based on a set of criteria that you provide. It might be through interviews, online or paper surveys, some combination. It really helps to collect the information about the providers in a uniform way and in a way that's very clear to them. You might also observe the clinic yourself, like my friend Inspector Gadget here. Visiting the clinic will give you a good sense of the overall atmosphere, location, how the staff perceive you, things like that. And then my personal favorite is to ask young people. It's so important in this work to engage them in the process. I used to work at DC public schools in my previous life, and I live to tell the tale. And we used a youth leadership group, a local youth leadership group. They were our secret shoppers. So we worked with them to develop scripts, and they called organizations and providers in their community to ask different questions, all aligned with those criteria that we just talked about. And then they ranked the responses based on that criteria. And it was a really engaging process for them, but it was also very helpful for us to understand like what they think about different providers, because sometimes their perspective was very different than what we were thinking about. And if you're interested in doing something like that process, I'm happy to share examples of what that looked like.
Excellent. Thank you so much, Sarah. At this point, we're going to turn it over. We have an example from Tecumseh Public Schools. So Tecumseh was looking around, looking at what service providers were in their community, and geographically where they're located, they are not they're not next door. The local public health department is not in the same city as they are. And also because of some of their hours and policies, there were also some other challenges to adolescents accessing services there. So they looked around and they said, what other opportunities do we have? And so they actually have reached out to the Corner Health Center, which is in Ypsilanti. And so, Mary, if you would share with us just a little bit about why you made that decision and what you found as you reached out.
Yes, we are trying to partner with our own local health department. I would like to mention that. It's been difficult to get them to come to the meetings just because our meetings happen to be the days that they have a clinic. They do have clinics on Tuesdays for anyone that needs reproductive health and other type of screenings, but the hours vary, and they're only on Tuesdays, and the hours change, and it's like nothing a student could remember at all. And our health department happens to be located, well, this seems ideal, it's all in one building, and it's right across from where the Secretary of State is. So in terms of confidentiality, I'm not so sure it's high. Well, convenient for people. Students get a little nervous about going to where you get your driver's license to be screened. So we looked at the Corner Health Center. Tecumseh is in the north part of our county, and so for students to shop or go somewhere, they're most likely going to go to Ann Arbor, or I guess they could go to Ohio. So I took 2 students that are on our committee, and they're also part of our GSA group at our high school. We visited Corner Health. We found it all of the things that she just aforementioned, very colorful, very clean. We loved it. Some of the things that we learned there is that they have just a multitude of opportunities for students. They have for example, they have a Latino night. They have a Man Up Monday night where they can do all kinds of testing and things for a young man. For example, they have really cool brochures. It's very student-friendly. You can get a physical, an STI test on a man night, a counseling. They have refreshments. They have haircuts even on Man Up Mondays, which are the first Monday of every month. Very easy for students to remember. They have an Out for Health the third Monday of every month, and the kids thought it was really cool that they actually have some gender identity clothing that can be made available to them. There's cooking classes, there's free food, movie nights, just really, really cool. Like, these would be easy for kids to get to. They also have like something on teen pregnancy and that. The neat thing, too, is that they have programs for students who are 12 through 25, and they're like a regular doctor's office, So they will take insurance and sliding scales and do all this type of thing, but it's just easy and more adolescent focused to help kids with stress and anger and sadness and depression and anxiety and eating disorders, just the gamut. They had a store there, which was really cool, that people could earn points in, like to purchase different things that they may need, whether it be a teen mom or a student who's struggling with an identity and wanting to maybe have some different clothing. It was amazing. We also learned that they have a theater group there, which we thought would be really cool, and they reached out to us and allowed us the opportunity. We're having our health advisory committee look at it to see if they could come out and actually present in our health classes. So we had to really think out of the box. We're trying to think about how we would advertise this information to our students. So we've ordered some plexiglass, stall advertisements, and our GSA group is in the process of designing information to put in those so that students would know what resources are available. The counselor's been giving these information, but we're actually going to do like a big marketing display of where could you go if you wanted some services. It's pretty hard in a little rural county to, make something like this happen.
Mm-hmm. Excellent. Thank you so much.
Questions anybody has?
Sarah, are you able to open the line for a moment and see if folks have some questions so far before we move on?
Sure. Hold on.
Thank you.
The conference has been unmuted.
Yeah, let's take just a second before we move kind of into the second half of the webinar and ask folks what questions you have about for Mary first, and then we'll open up for general questions so far. So any questions for Mary about their experience and how they went about it?
None at this time.
Okay. We also had them the corner people come to our committee, which we felt like that was really important. We're not shutting the door with our own local health department. Please know that. It's just that we have to try to look out of the box.
And, choices are important. So you've identified some great reasons for diversifying those, and that's really what we want here as well. Great.
So Mary, this is Laura. I was wondering if there was anything that you learned, maybe specifically around the services provided, that surprised you or that you didn't know or the students didn't know.
Well, the students were really impressed with the fact that you could get like nutrition information, smoking cessation, that you could go there. The flexible hours they really liked. The confidentiality part they thought was just huge. They didn't think it would be a real large obstacle for a student to get there. It would take maybe 35 minutes to get there, but their evening hours they felt would be really conducive to being able to have a student go there. They felt like very welcome too because they could bring members of their GSA group there for a tour, which we felt like might be a really good way to spread the news because it's hard for kids to know that. No, I think that the whole gamut was there: the nutrition, the stress, the Latino, the the pregnancy, the out for health. I mean, it just had everything that you could need in healthcare.
Awesome. I'm wondering, thank you, is there anyone, Kim, I know that you were kind of doing multiple things, Kim Phillips-Canope, but I know that there's a few state-funded school-linked health centers, of which the corner is one of them, and I'm wondering about, because I think that those school-linked health centers have more flexibility because they can provide contraception, et cetera.
Oh, yes, they can do that for sure. They went in great detail about all of that, and the kids were like, wow.
Kim, are you able to, are there some other school-linked health centers that are in close proximity to any of the SHIFT districts like Detroit? She may be tied up with another call or something at this moment.
I'm very sorry, ladies and gentlemen. I have to shove off to another meeting.
Thank you.
But thank you so much for inviting me. Good luck.
Thanks.
Bye.
Yep.
I will mention, and I'm sorry I'm kind of limited by my geography, but I do know that in Detroit proper there are two. One is the Youthville Center, which is managed by Henry Ford Health Systems, and it is on the corner of Grand Boulevard and Woodward. And then another one is called the Healthy Teens Center, which is just off of the Lodge on Martin Luther King Boulevard. So there are two school-linked health centers in Detroit, again, that provide the full gamut of services, including birth control.
And I know Kim Phillips-Canope was ready to say something, but she was muted. So her phone number is 248-210-3523. 948-210-3523.
Everybody is unmuted. She should be.
Gotcha. Okay. Maybe a technical difficulty at her end. Well, that's helpful. Thanks so much, Amy.
Yep. No, thank you. All right. So should we go ahead and go forward, or are there other questions? I apologize. I should hesitate before we mute everyone again. Are there other questions of anyone on the line for anything that we've talked about so far before we move forward?
You were talking about close to Detroit. The Macomb County Health Department opened up a clinic at Thompson Community Center, which is at 9 in Hoover, which is very close, and 11.5 in Van Dyke. We also have a clinic. And we take anybody from Wayne, Oakland, wherever they come from. They can come and seek services for birth control.
Excellent, excellent. Yep. And again, your local health departments, or if you have a local Planned Parenthood, those are, again, those Title X agencies that I spoke of. So excellent, excellent.
Great, thank you.
All right, I think you can go ahead, Sarah, and mute folks, and then we'll move on with the next step of the
The
framework.
conference has been muted.
About some of the things that you want to look at when you are looking for providers, and things to consider and thinking about, are they youth-friendly, are they adolescent-focused? And now we're going to talk for a second about breaking down barriers, because while it sounds like the Corner Health Center, as an example, had many, many of the attributes that we want to have in place for the adolescents that we're sending out for services, there are going to be barriers, there's going to be challenges, and there are a gamut of those that can come up. They include things like transportation or challenges with your policies, concerns around confidentiality, and some of those may be that literally there is not a place that provides confidential services nearby, or it may be adolescents' concerns and perception about confidential services. There's stigma, cost, appointment times, languages spoken. So there's a number of things that may come up in terms of barriers, and we want to talk for a second about how to figure out what those are for your particular school district, as well as then some ideas about overcoming some of them. So the first step to, of course, breaking down any barriers is to be clear on what are the barriers that are particular to you and to your school and to the students who you have in your school. Because while one district may be all about transportation, for somebody else that may not be a problem. That it may be that, you know, a facility is very close by, but there are other barriers and other things that get in the way. And so this is actually a visual of a tool that we worked with you, those of you who are from the SHIFT districts. A few months ago, we sent this out, and many of the school districts were able to incorporate it, and some were not able to at the time. And so we just wanted to remind folks of it. This is a brief questionnaire. It can be done in like a focus group or a small group. It can be done one-on-one with individuals who are on your committee or to a subgroup of adolescents from your site. So wanting to understand that, just asking some questions, and that this goes back to Sarah's comment about one of her favorite ways to find out about youth-friendly services is to ask the youth. And so we will make sure that we send this resource out, that make sure that you're aware that it exists and that you have access to it. But I wanted to just remind us a little bit about what we did here from the school districts that did implement this process and were able to do some interviews with their kids. When talking about barriers specifically, some of the most common things that came up were, one, fear of being judged. So fear that when they walk into a clinic, what will they experience? Will they be judged if they have to ask somebody at the school to help them to access a service? Will they be judged by the facility by itself once they actually get there? So that fear of being judged actually was the #1 concern for youth. And I think that that speaks to us in terms of not only the provider partnerships that we identify, but also the language that we use, the procedures and the processes that we use to raise awareness, which we're going to talk about a bit, but always remembering that that fear of being judged actually boiled to the top in terms of fear of concerns and being a barrier to accessing services for adolescents. Another one that came up, and we've talked about it a lot here around confidential services, is that fear of parents finding out. And while we want parents to be involved in the decisions that affect their adolescents, there are times when adolescents feel like they just can't, and that in order for them to access those services, they need to be able to do it outside of that. And that did come up, again, in the questions to the teens. And so having their voice included in this work is really, really important and a piece of the puzzle there. And then some of the more maybe ones that would come to our mind, first of all, things like transportation, things like I don't know where to go, I don't know where it is. So I may have a car, I maybe have a couple of hours after school that I'm kind of on my own, but I don't know where it is there going to be free parking, where do I go once I get to that building? So things that will break down kind of the unknown. That's what I often talk about when I'm talking about adolescents and really anyone, but particularly adolescents and accessing services, is that you want to do things that break down the unknown. You want to make it as easy as possible, not only physically, but mentally and emotionally for adolescents to access the services that they need. So I'm going to take a second, and you can chat in for us. And you have your chat box down in the bottom left-hand corner of the screen. What barriers to facilitating access to health services do you see, and how do you manage them? Go ahead and take a second if anyone has a comment that they'd like to add in. Anything that folks have come across in terms of barriers to accessing these services, or barriers from the student perspective? So we're hearing from Heather, and Heather from Ottawa County notes that just knowledge of the services that are available. What is out there, what can they get, and what to expect there. Chris says, what services can we refer to? Understanding that certain districts are more or less conservative, so kind of what are the options and opportunities?
Yeah, and this is Lori. I just can't speak to that enough about how important it is if you have a list of, here are the places that people can go for suicide help or for this or for that, different issues, that whatever that list is, that you want to make sure that you're completely transparent about it and that people know about it and that you're supported, because you don't want to have people going off on a limb on that and recommending services that the school district will then can't stand by.
Great observation, thanks. We also hear transportation. Again, understanding that there may be buses in the community, but does the bus go from the high school to the health center? And does it happen in a timely manner? Again, oftentimes this may be something that kids are doing in a short window of time. Wait times can be a real challenge. So it might be that there's a fantastic clinic, but frankly, after school, it gets bombarded. And so the wait time is a couple of hours, and that's not an option sometimes for youth. So being really aware of that and making sure that kids understand if they need to make an appointment, how to go about that, and because some things like that can help them to be able to get in and get out in a more timely manner. All right, thanks you guys. Thanks for commenting and for sharing with us some of your thoughts and experiences. We're going to go ahead and move on, and we're going to talk about Van Dyke and highlight Van Dyke Public Schools for just a second. A couple of things that come to mind with this is that, again, we've been talking about the barrier of reaching out and accessing public health services as one place, or local public health as being one place where adolescents can access confidential services. And we have with us today Patty Dietrich, who is actually from Macomb County Health Department. And Patty is one of the members of the leadership team for Van Dyke Public Schools. And she's going to talk a little bit about the partnership between the school and the health department and how it is working to benefit both. So Patty? Sarah, are you able to see Patty or unmute her? She's a 989 number.
Yeah, she was unmuted, and now I don't see her.
I think she's at the very bottom.
Hi.
Patty, are you there?
Yes,
I'm
Patty.
here. Can you hear me?
We can. Go right ahead.
Okay, great. We have a great partnership with Van Dyke Schools. With Patricia Magus is the school social worker, and Piper Bogner, she is the assistant superintendent at the school. And we attend the shift meeting every other month with them. And they have a variety of partnerships that attend this meeting, anywhere from care. They talk about suicide prevention, reproductive health, birth control. They have all different people, health educators, that are on this shift meeting. And we also have a clinic about 2 blocks away from the school on Hupp Street at 9 and Hoover, right down the street from Lincoln High School. And we provide free to low-cost birth control, and we counsel students. We provide reproductive health education about contraception and STIs, pregnancy testing. We do a variety of different testing there at our clinic. And we also have another clinic at Van Dyke and 11.5 Mile Road. And teens are very welcome. The fees are based on the ability to pay. We are a Title X. It's strictly confidential. It's private and confidential. We provide a lot of education, counseling. There's no residency requirement, so we can take people from Wayne County, Oakland County, wherever. They come into our clinic, and we will service them. We're trying to prevent unwanted pregnancies, and to help the teens get ahead. I was actually one of the students that came to family planning many, many years ago, so I could be a poster child for the program back in '84. And it's an awesome program. My life could be very different without the family planning program and birth control. So
Sure.
It's truly a wonderful program. And the ladies that all work there are truly their parents, sisters, aunts, so they can truly tell where the teen is coming from, and they can help them in abstinence and anything, any kind of counseling.
Thanks, Patty. Patty, can you talk about, if you could, what has been the benefit to your clinic of partnering with Van Dyke?
Well, to get the word out in the community, going to the shift meetings, they have had students that made up their flyers for our program. It was in their design class. It was actually part of their curriculum, I guess. They did their graphic design class, and they made all kinds of flyers for family planning, also for suicide prevention and all this. And then they put them in their bathrooms in a little pocket they have on the doors for advertising, and it's got everybody's phone number in case a teen's in trouble and needs help. They can just call the phone number or put it in their cell phone or whatever, to access the services.
Absolutely.
Patty, I have a question. This is Lori with Michigan Department of Ed. And I know that, originally there was an issue that even though the health department was nearby, that students were going to have trouble getting access to it. And so it sounded like through the partnership between the school district and the health department that you actually have a new, you have a whole new venue where you provide services that's right there for the students. Can you talk more about that?
Oh, yeah. We are in the Thompson Community Center, which is probably a block and a half away from the high school. And there's probably 3 other schools around the community center. What is provided at this community center is the WIC program, which is Women, Infant, and Child Supplement Food Program, and for pregnant people, to provide nutrition and nutritional education and also nutrition foods. They also have the Action Center there. It's like a big access to services in one place, one-stop shop. Michigan State University Extension is there. The Action Center's us. Who else? Youth Development 4-H is there. So
would you recommend for school districts that aren't close to a provider that they could talk with the health department about maybe, opening a satellite clinic or program near them or on, so that they could have greater access for their students?
Oh, yeah. If anybody's near us, we are in Macomb County, and we have been partnered with several people. So, if there's any school district that wants to partner with us and if they can find us a spot close by their school that will house us. We travel every day. We're in a different spot, so it's the same staff.
Wow.
Like on Mondays, we're at the Thompson Community Center. Tuesdays, we're in Mount Clemens at the Health Department. Wednesday, we're in St. Clair Shores. Thursday, we're in Warren at the Van Dyke and 11-mile one. And Fridays, every other Friday, we're back at Thompson. And every other Friday, the second and fourth Friday, we're in the Mount Clemens Health Department. So
great. Well, I was thinking New Haven is another one of our districts that is in Macomb County, and I know that it's a little harder for their students also to access services, and we have someone from New Haven on the call, so maybe some partnership worthy of exploring.
Oh, yes. If you would like to partner with us and you have a spot for us to be close to your school, I can give you my phone number at work, and I will say it right now. It's 586-469-5491. I will be back in the office on Wednesday. I'm off right now. I have a funeral to go to tomorrow. So
thanks for being on. And Diana from New Haven did email in and said that does make sense, that she wants to explore the idea of possible partnerships.
Awesome. Awesome. All right. Thank you so much, Patty, and thank you for making the extra effort to be on when you're out of town, so we appreciate it.
Yep, thank you.
All right. We are cooking along in terms of time, so I'm going to keep us moving, if I may, and move us right into the next step of the framework. I want to just so much appreciate and thank those of you who are chiming in with your experiences and your examples, because it makes it feel possible. It makes it feel doable, and I appreciate you sharing with us and with others who are on the line. So talking about raising awareness, which is the fifth step, and actually Patty gave us some great segues into this, because she was talking about some of the things that they've been doing and Van Dyke schools have been doing to raise awareness of the services that they have and how to access those services. So when we're thinking about raising awareness, we want to make sure always that we're thinking about the multiple audiences that we need to raise awareness with. We need to raise awareness not only with our adolescents, but we also need to raise awareness with their parents, with our community partners, with our school administrators, making sure that everyone has information to be helpful and also everyone has information to be a part of the process. So as we've been talking about transparency and awareness, remembering all of those different audiences. Some of the examples that are listed here are ways to raise awareness, and they include some of the things that, again, have already been discussed. Posters, items being put up in restrooms has been one that's been talked about a number of times, newsletters, newspapers, providing lists and information at school events. That might be sporting events, it might be award nights, so those can be a lot of different ones. Although Piper from Van Dyke is not on the call today, she did offer us a list of some of the other places that she is putting information and working to raise awareness. And I just wanted to highlight a couple of those before we move on. Things that I thought were novel, were maybe things that others hadn't thought of. One was to include literature in the counselor's offices or social work offices. Again, maybe not news, but something as a reminder if you're not already doing it. Including literature in the administrative building, where families may be more likely to see it. Maybe they're there registering a new kid, or they're taking care of other business. So again, thinking about those various audiences, where can you put information so that everyone is aware of what's going on and everyone can be part of the solution. All right. Now what we're going to do is we have a couple of examples of some brief videos that were done by Ottawa County Health Department, who is a partner with our school district over there. And these are examples of videos that could be used to raise awareness. So if you have something similar in your community, or you wanted to look at the opportunities here, I'm going to show the first one. The first one talks about what a student could experience or what they should expect if they were to go to the health department to receive services. So with that, I'm going to go ahead and just play it quickly. The audio for this will come through your computer. So make sure that your audio is on and that you have it up so that you can hear it, because we're going to have two videos right now. And again, that audio will come through your computer. Those of you who are maybe just looking at the slides, I'm going to try to give you some audio, but I apologize if it doesn't work. They're only 1 minute, so it won't be too long. We'll be right back.
Did you know that Michigan ranks 15th in the nation for having the highest number of people with chlamydia? and most people who have chlamydia show no signs or symptoms. This is why you should come in and get tested. The Ottawa County Department of Public Health offers free or low-cost confidential testing for chlamydia. Chlamydia is a sexually transmitted infection, and if left untreated, it can cause serious health risks for both men and women. So, what can you do to protect yourself? Know your partner, use condoms every time, get tested, and know your status. With a simple urine test, you can expect your results in 1 week. Young adults under the age of 18 do not need a parent's consent to get tested. If you test positive, you'll receive a one-time dose of antibiotics along with information about notifying your partner. It's really that easy. Call us today for an appointment at 616-396-5266. To find out more about testing and sexual health services, please visit www.myottawa.org/sexualhealthclinic.
All right, so that was, again, an example of a very brief video. It's basically a commercial. It's a 1-minute video that could be shared at an event if it's approved by your school district and is approved by your administration. It could be, if with approvals, it could also be done during like morning announcements. So there's lots of ways that you could increase access to that and allow folks to be aware of it. The next one I'm going to show is it's a different service. You know, we talk about access to sexual health services, and oftentimes we do get really focused on access, for instance, to STI testing or to birth control in the form of pills or LARCs or long-acting opportunities. But in fact, condoms, we know, and access to condoms is something that we can't do on school grounds, but it is an important sexual health service, and it's an important tool that folks can use to be safe. And so this is another video from Ottawa County Health Department, and yes, thanks so much to Heather Alberta, that demonstrates actually some students accessing condoms at Grand Valley State University. And they have a partnership with Ottawa County, but there are a number of places in the community where individuals of all ages can access condoms. So we're going to go ahead and take a look at this brief video. Sarah and Lori, can you tell me, were you able to hear the audio at all through the phone? Do you know?
No.
No, okay. Sorry about that.
Okay.
So again, those of you who don't have audio, I apologize. It'll just be 1 minute.
Hi there.
Hello.
How can I help you?
I am here to volunteer at the pantry downstairs.
Yeah, no problem. And here, take a few of these condoms with you. They're free.
You guys just give out free condoms.
Yes, sir. Have you heard of the Wear One campaign?
I have not. What is that?
It's a campaign founded by the Ottawa County Department of Public Health. It offers young adults easy access to free condoms.
Free condoms?
Yep, it's all free. Here on campus, we are located in a variety of places as well as multiple sites throughout Ottawa County. For more information, you can visit our website at www.myottawa.org/sexed.
Well, thank you. I will take a few of these. I'll take a few more.
Are these, free?
Yes, they are. Courtesy of the Wear One campaign.
Guess I'll take one then.
All right, and again, thank you. I'm just seeing here some back and forth. It says here on the screen where it says that the video was created by students at Grand Valley State University, and Lori had asked Heather about the cost for this, and in fact, Heather responded that it was free, thanks to that collaboration with Grand Valley. And so that, again, might be something for folks to pick up on and to consider as you're thinking about community partnerships that might be beneficial to you. Lori, is there anything else you would like to add to that?
I can't think of anything at the moment.
Okay, very good, very good. So we've already talked a little bit about other examples of creating awareness. Again, I mentioned the couple from Piper. We've talked about flyers in bathrooms, and I really do love that one because it is an opportunity for folks to access the information privately, to jot down a number or put it in their phone discreetly. So that's a great one. But also understanding that those information opportunities cut across issues. It may not just be your access to sexual health services, but other messages associated with SHIFT that you want to be rotating into that type of a venue. All right, we're going to take a second now, and we're going to move to another health department partner, and that is through Northwest Community Schools. Dee Dee is going to be talking just a little bit about their experience of breaking down the barrier, and this I do think is more or as much about the psychological barrier of accessing school health services. So let's see if we can get Dee Dee. Dee Dee looks like she isn't off mute, so that's fantastic. Dee Dee, can you hear me?
Yes, I can. Can you hear me?
We can hear you. So can you tell us a little bit about the exercise that you went through?
Sure. In our required 9th grade health class, we have a day where we've made arrangements with our school-based health center. We are at the high school, and the health center is at the middle school across the parking lot. And we prep the kids on good, and it relates directly to some of the accessing information and all those health skills, 7 health skills for the health curriculum for the state. And we prep the kids with, hey, you should ask these questions, et cetera. Then we walk across the parking lot. We walk everybody into the clinic, and then the front desk staff introduce themselves and all the workers. And at this point, because of HIPAA laws, there are no patients in the clinic, so we don't mess up anybody's privacy or anything. And then we take a tour of the small clinic in the different rooms, and we meet all of the staff, and they tell us about the services that they offer. They hand out any paperwork, the permission to treat packet and all that, and then we walk back to school, and the kids ask questions, and then we walk back to school and process it a little bit.
Awesome, awesome. And what I love about that is you said you do it in your freshman health classes. So it becomes, it's a norm. Everyone's going to have the same experience once that is approved by your school. It's not something that you're singling people out for, but it is kind of that common practice. And as you said, it increases those skills of being able to access information, being able to access services, and those are fantastic. I really appreciate it. And so, again, if that's not something that you've considered in your school district, then it may be something to think about if a tour or an outing to a community-based partner might be something that would be beneficial for your youth to demystify that experience. So thanks, Dee Dee.
Yes, you're welcome.
Absolutely. All right. So the last step in the framework is establishing procedures and referrals. For referrals. And so Sarah is going to talk just a little bit about this. We're not going to dive too deeply today, but we know that this may be a next step for some of you and something that many of you have already started. So Sarah?
Yes, and thank you everyone for your wonderful examples. I can promise that when I talk to other states, I will definitely talk you all up about the good work that's going on in Michigan.
Yay!
So I wanted to talk just briefly about procedures for referrals. This is the final component in our kind of framework for facilitating access to services. I know that it's getting a little in the weeds for many of you, so again, just a quick overview. And I should also note that a lot of you may already have some sort of referral procedure in place for things like mental health, asthma, behavioral concerns, things like that. So there's no need to get too stressed or in the weeds with this. And no need to recreate the wheel here. Feel free to use what you have and apply to different circumstances, especially if that process is known and comfortable for your school community. So the main pieces that we have here are who should make a referral. So who are those folks in your building that maybe have a little bit of training or accessible to students? How can all of the school staff play a role? So who knows about the resources in your community? Who can direct students to those resources? And how might students conduct self-referrals? So if, all of these marketing and raising awareness ideas that you all have been sharing, that's a really great way for students to just identify the resources themselves. So then what steps are involved in making a referral? There are many, and we can share those with you after the webinar, but really just thinking about how you'll identify a student's need, using that resource guide or that pre-vetted list to select the provider that is appropriate, and then how to actually go through with that process and document the information. And then finally, where can students go in the community for services? So think back to the resource list that we cultivated in step 3, and referrals might only be made to those providers in your school community, just so it's clear who those providers are and we know that they're quality services. And if you want more details about how to make a referral and what steps are involved in that process, you can access that list in the full downloadable toolkit if you're interested in exploring that more. So that brings us to the end of our time together. So just as a quick kind of discussion, you can chat in or we can unmute the lines to think about what are some of your next steps based on what we talked about today and how, I say we, and I'm always on your side, but mostly Lori and Amy at the state level and some of your community resources in Michigan can help that process.
And while people are thinking or typing in, I just want to say again that you may feel like, wow, we haven't done a lot in this arena of facilitating access, but you really have. And wherever you're at, you know, if you're in a conservative community, like, you know, Brighton's in more of a conservative community and struggling with, you know, thinking about what providers you can give out, like you're all in different places, but you're doing fabulous work. And there's no expectation that everybody be at the finish line here.
Absolutely. Sarah, can you go ahead and unmute people? I think sometimes it is easier to just ask a question verbally since we're near the end.
Yep, absolutely. Hold on.
The conference has been unmuted.
All right.
So any comments from folks? Questions, thoughts about what your next steps are? Maybe something that's come to you during this call? Just chime in.
It looks like Dee Dee said she'll be following up with her district policy person and their school-based health center staff to create some policy and standard referral procedures. So again, I think those of you who are in districts that have a school-based health center, that is, you have that in common. You can kind of share ideas about or draft policies or procedures that you've already developed. And Diana talks about from her district that it looks like that she'll need to call the health department and the regional health coordinator to see what they can do in terms of partnerships. We also have an access center steps from the high school. That's great. Chris, I'm glad it was helpful information to get moving forward. I just so appreciate both Amy and Sarah with National Coalition of STD directors. We have such amazing partners at the state and national levels, and we could not do this work without you. So just want to say thank you, thank you. Also, Kristen, who's on the state level team from, also from the Michigan Department of Health and Human Services. She works with school-based and school-linked health centers. She wanted to be on the phone, but was out of town, and she's very supportive of these efforts as well, as are everyone in the health department.
Absolutely, and this is Amy. We're going to be wrapping up here, but I do want to just thank everybody as well and to say that I will be seeing you guys at our shift meeting at the end of next month. I'm looking forward to that.
Great. So even if people didn't have time to type into the chat or you're still thinking about it, please email me or Amy ideas you have about kind of what are the next steps, what do you need next in terms of moving things forward, because we can focus on those pieces when we're at the Learning Collaborative meeting in April.
All right, Sarah, do you want to talk them through the evaluation?
Sure. So at the end of this webinar, you'll be automatically directed to an evaluation. We ask that you please complete it. It's very helpful to, I know, to Lori and Amy and actually myself in figuring out how to better support you all and what types of resources and information you'll need and what types of other webinars or in-person learning opportunities we can provide for you. So the evaluation, I promise it'll take less than 5 minutes, but we really appreciate your feedback, and you should be automatically directed to it. And we can email it out also afterwards in case you don't get it.
And then one other piece just as we're wrapping up. So we talked about this new framework. We referred to these different components of the framework, and that is something that we emailed out right before this call. But please know that this is definitely a draft framework. I would really appreciate people's feedback about things that are missing or need changing, and I will definitely make sure to email you, but also those who were not able to be on the call because these things are a work in progress, and we want to make sure that we're providing a framework that really meets your needs and speaks to the issues that you need to move forward on sexual health services. So I think with that said, I think that thank you all for being on the call. Thank you so much again for all the speakers on the call and people for sharing your stories of what you're doing in your local districts. We'll be making this recording available, and please take a few minutes to fill out the evaluation and let us know what we can do next to support you in your work. Happy Monday.
Happy Monday.
Happy Monday. Thank you, everyone.
Bye, everybody.
Thank you.